Welcome, everybody. We are honored to offer Pregnancy and Infant Loss Awareness Matters with presenters Loralee McInroy and Brandon Drouillard. My name is Haley. I am the Performance Improvement Lead with the Northwest Regional Palliative Care Program, and I will be your host and moderator for today. And I apologize, I can't see the chat, so if you can't hear me or if I'm missing something, please speak up. So we'd like to start today with a land acknowledgement. The Northwest Regional Grief and Bereavement Community of Practice would like to respectfully acknowledge that we are located on the traditional lands of Indigenous peoples. Thunder Bay is located on the traditional lands of the Fort William First Nation, signatory to the Robinson Superior Treaty of 1850. We acknowledge the history that many nations hold in the area around us and are committed to a relationship with First Nations, Métis, and Inuit peoples based on the principles of mutual trust, respect, reciprocity, and collaboration in the spirit of reconciliation. As a program and community of practice, we are committed to recognizing reconciliation, decolonizing our work, fostering relationships, and looking for education and action opportunities, both personally and professionally. On a personal lens, I've committed myself to learn more about colonization and take action towards truth and reconciliation. As a volunteer, I have taken the 7 grandfather teachings and will continue to seek out more opportunities to be involved and further my knowledge. As we get going, please do feel free to introduce yourself in the chat and let us know your role and where you're joining us from. A couple of housekeeping reminders for today. Please stay on mute during the presentation. We do hope to have time for questions at the end. However, if you need something repeated or clarified throughout the presentation, please use the chat box. There will be an attendance draw prize. For each of our 6 presentations, we are asking our presenters for a book on grief that they recommend. We will draw for the book at the end of the session, and you must be present to win. A short evaluation will pop up when you leave the session today. Please take a moment and complete that for us, and it will help us plan for future sessions. The session today will be recorded and archived on the SARA YouTube channel and sent out to registrants in the next week, along with the slides. We're happy to have you keep your camera on, but please note that your image may be shared or captured in the recording. We will also send out a listing of any resources discussed today. And just for your knowledge, the book that we'll be drawing at the end of today's session is titled Through, Not Around, Stories of Infertility and Pregnancy Loss by Alison McDonald Ace. Without further ado, I'd like to introduce Loralee McInroy and Brandon Drouillard, and I'd like to pass off the torch and I'll stop sharing my screen for them.
Thank you, Haley, and thank you everyone for joining today. As Haley mentioned, my name is Brandon Drouillard. I work for the PAIL Network as a pregnancy and infant loss educator, as well as the education coordinator. I am joined by my colleague Loralee McInroy, and she'll introduce herself in just a moment. But I don't come to the PAIL Network from a traditional healthcare background, but rather a personal one. In June of 2018, my wife Sarah and I got married, and in July of 2018, we found out Sarah was pregnant with our first child. We were shocked and excited at the idea of becoming parents for the first time. In the first few months of Sarah's pregnancy were typically normal. In the fall of 2018, Sarah started beginning to experience symptoms of preeclampsia and was followed more closely by her OB here in Peterborough, Ontario, where we live. We were sent to a larger hospital in Toronto a couple of times through the fall in early 2019. And then in February of 2019, Sarah's preeclampsia developed into HELLP syndrome, and her life and her daughter's life was at risk. Sarah was induced for an emergency C-section at 29 weeks and 6 days. Our daughter, Hannah Grace, was born weighing 2 pounds, 4 ounces, and spent 3 days in the NICU at the hospital in Toronto. During that time, she suffered 2 pulmonary hemorrhages, both of which Sarah and I were witness to, and the second of which was ultimately fatal. After Hannah's death, Sarah and I really struggled with our grief and our emotions around her death. We found great comfort from the PAIL Network, from their peer support programs that Loralee is going to talk a little bit about more in a short time. And through that, I became a volunteer family panelist for PAIL Network's compassionate care workshops, which I'll talk about in a few minutes, and found great comfort in that. Through that work, I became an educator in 2021 and then transitioned into my role as the education coordinator in July of 2024. I've had the great privilege and honor of traveling the province from corner to corner to corner and many communities in between, connecting with professionals like yourselves and sharing stories of families, both compassionate and uncompassionate care that they received, and really looking forward to sharing some of that information with all of you today. Now I'll pass it over to Loralee.
Thanks, Brandon, and thanks for sharing Hannah with us. I am Loralee McInroy, and I'm the Family Support Coordinator. I am similar to Brandon. I came to this work as a bereaved parent back in 2014. I was pregnant with our middle daughter, and unfortunately, she had a medical condition that wasn't compatible with life. So we chose to do a medical termination at 22 weeks. We did get to spend a couple hours with her. It's never enough, but her name is Angel, and that's kind of what brought me to this role. Before this, I was a dental hygienist, and I am fully retired from that role, and now I do this role. I did start as a volunteer, same as Brandon. I did peer support, so I was supporting other families. At the time, I didn't know anybody who had had a pregnancy loss past that first trimester. So I just didn't want other families to feel that way. So that's why I joined at first. And then I continued on. When we joined Sunnybrook, we had regional reps, which support the volunteers in certain areas. So I had that role for a while. And then I moved into the intake, the referral coordinator for a year. I did that mat leave. And then most recently, I have the family support coordinator role, which I absolutely love my job. My role is supporting and creating new resources and supports for families, listening to families, hearing what they need. And I continue to do that every day. And it fills my cup and is a way to honor my daughter. Thanks, Brandon.
Awesome. Thank you, Loralee, and thank you for sharing a bit about your journey through the PAIL network as well. Loralee and I have quite a bit of content to get through today and not a lot of time, so we're going to try to be really brief through some of the supports that we have available on some of the things we wanted to talk about. As Haley mentioned, you will get a copy of the presentation. If we don't address what you're looking for from this presentation, or if you have further questions that we don't address in our hour today, our contact information is at the end of the presentation. Please feel free to reach out to either one of us or both of us if you have follow-up questions or want to discuss anything that we talk about here today further. So I'm going to talk a little bit about the PAIL network and some of the supports that we provide, and then we'll talk on a couple of themes around pregnancy and infant loss, and then we'll save some time for questions at the end. So the PAIL network started out as the Perinatal Bereavement Services of Ontario, or PBSO. And that group was created in 1992 by a group of families and the sick kids who met, in the NICU at Sick Kids Hospital. Sorry about that. The group was later renamed PAIL to make it easier for families to find and to access. The main focus of the group has always been to provide peer support and to support the education of pregnancy and infant loss in Ontario. The group was later renamed to PAIL and was easier for families to find and to access. And during that time, the group was also running exclusively by volunteers and with the help of small grants and donations. And so for a long time, our organization was largely funded by volunteers and with small donations. Then in 2015, after experiencing a personal loss in his family, Member of Provincial Parliament Mike Call introduced Private Members Bill into Ontario Legislature, and that Private Members Bill was named the Pregnancy and Infant Loss Awareness, Research and Care Act, and that bill passed quickly through Legislature with full support in 2015. The bill focused on three main areas, and they were awareness, care, and research, and Loralee and I will touch a little bit more on each of those areas as we work through the presentation today. The bill proclaimed October 15th the official Pregnancy and Infant Loss Awareness Day in Ontario. That day is widely recognized as the official Pregnancy and Infant Loss Awareness Day around the world, but was officially proclaimed Pregnancy and Infant Loss in Ontario with that bill. That bill also came with recommendations for action. The PAIL network received dedicated funding from the Ministry of Health. And in 2017, in January 2017, the PAIL network became a part of Sunnybrook Hospital's DAN Women and Babies program, and that move was mainly for organizational oversight and for funding agreements. And then finally, the bill focused on pregnancy and infant loss research. We have proudly partnered with Health Quality Ontario to develop a early quality standard for early pregnancy complication and loss. And we also conducted a provincial needs assessment in 2017 as a part of that bill, and that really founded or grounded and was the foundation of the work that the PAIL Network began. And I'll touch a little bit more about that provincial needs assessment and what we found out from families in Ontario in just a moment. As we see on the screen here, as many as 1 in 4 pregnancies end in loss. And you see on the screen in 2017 and 2018, over 30,000 patients who visited the emergency department in Ontario were diagnosed with an early pregnancy complication and or loss for a total number of 48,000 visits. So that represents over that 1 year time period, approximately 106 visits to ER departments in Ontario every day, or one family every 14 minutes. Underneath that, you see that approximately 8 babies are stillborn every day in Canada, and approximately 5 babies die within the first year after birth every day in Canada. And so those two stats there represent one baby, one family every 2 hours. So one family in Ontario presents to an ER department with an early pregnancy complication or loss every 14 minutes. In Ontario, and one family every 2 hours loses a child to stillbirth or to infant death every day in Canada. And so we share these stats with you to really highlight and bring forward how prevalent pregnancy complication and loss is. We'll touch a little bit on stigma in a few slides, but the fact that so frequent these losses are occurring and happening for families in Ontario and Canada, and how little we talk about these losses really creates a stigma and tons of challenges for families to process their grief and navigate their losses. And so we also share these stats with you to really bring forward that whether you're supporting a family directly for a pregnancy or an infant loss, or they have a history of loss in their medical history, a negative interaction with the healthcare system, or just experiencing the loss themselves itself, can lead to challenges that families will have interacting and navigating healthcare systems for the rest of their lives. And so acknowledging that whether you're supporting the family for that loss specifically, or for an unrelated reason, their interactions with the healthcare system can be challenging because of that loss. And as I mentioned a couple slides ago, in 2017, we had the opportunity to engage a provincial needs assessment for families in Ontario. This type of engagement, this type of assessment had never been carried out before. And so really there wasn't any history, there wasn't anything for us to work off of what the state of pregnancy and infant loss care in Ontario was. And so this gave us a really unique opportunity to engage with both families and healthcare professionals. And our mandate was to expand the support of education from the Ministry of Health. And so the results of this provincial needs assessment really guided the work that we began and still be take on every day. And so you'll see on the screen here um, that we had the opportunity to ask 596 families, what was your experience at the time of your pregnancy and infant loss? And I'll give everyone a moment to read some of the responses here. But 53% of families did not feel they were treated with kindness and respect. 72% did not feel the information they did not receive, excuse me, the information they needed from healthcare professionals. 65% did not feel supported and cared for. 45% were not told of available supports available to them. 69% felt their healthcare provider didn't have the skills to respond to their needs, and 51% experienced stigma from a healthcare provider. And so obviously these stats and these responses from families were disappointing. Um, but as I mentioned, they really guided the work that we needed, and we know that these numbers are not a reflection of the ambition or the hope of professionals to provide skilled and compassionate care to families, but rather the lack of supports available and the lack of education available to professionals, and also the lack of lived experience to feedback to give to these professionals to shape or shift or improve bereavement care. And so we don't share these to make anyone feel bad about their jobs, but just to show that the lack of awareness and supports for both families and professionals was prevalent in the province And we have taken great strides towards these. We haven't updated these numbers yet. Hopefully something that we can do in the near future, as I really do think that these numbers would be a dramatic, would shift dramatically towards more compassionate care for families. We'll talk a little bit about through the presentation about educational for healthcare and service professionals and a few slides. So I'm not going to touch on that now. So I'll pass it over to Loralee.
Thanks, Brandon. So yeah, Brandon mentioned we do have the 3 areas we focus on. So they're peer-led support in Ontario, which is basically what I do all day, every day. So this is providing support to families who've experienced a pregnancy or infant loss, education for healthcare providers, which is what Brandon does. He's in charge of all that. And then advocacy and awareness, which we all do as a team. We do have a team member that focuses a lot on that, but as a team, we are always trying to increase awareness and advocate for these families. So going on to our peer support program. So any family in Ontario who has experienced a pregnancy or infant loss at any point can access our supports. There is no timeline. They can access it whenever it feels right for them. They can join, they can stop, they can join again. We have 3 different types of support we currently offer. We have online support groups, we have in-person support groups, and we have one-to-one phone support. One-to-one phone support, they're paired up with a volunteer who's had a similar type of loss. We can also pair them on other factors depending on what the families request. So they could request that they're in Northern Ontario and would like to have an experience with somebody else who had a loss in Northern Ontario because their hospital situation or experience may be very different than somebody who lives in the GTA. So we are able to match that. We do sometimes on religion, beliefs, that type of thing can also be matched. We also can offer it in different languages. We have volunteers that speak multiple languages. If we can't, we do have a translation service too that we can use. In-person circles of support. So these are a mixed loss group. So anybody who has experienced a pregnancy or infant loss can join these groups. We do have, I know I was looking through here and we have groups all over, are people joining from all over Ontario. I do want to mention we do have one in Thunder Bay currently, which is awesome. But if you're wondering where we have support groups, if you look at our website, that's probably the best place. I'm continuing trying to add more locations, so I could give you a list today, but it would probably change in the next few months. So check out our website wherever you are in Ontario to see if we do have one close by. And then finally, we have our online support groups, which are hosted on Zoom. They are facilitated by 2 facilitators that have experienced that type or category of loss. So they are broken down by category of loss. So first, second, third trimester, infant neonatal loss, infant due to SIDS, elective abortion, termination of a pregnancy for medical reasons, or loss of a multiple. And then the other types of groups that families can join is pregnancy after loss group, trying to conceive group, parenting through loss. We have one for partners in grief because often we hear the non-birthing partner feels that they're kind of left out from that. The non-birthing partner is welcome to join any of the other supports, but they do have a group specifically for them where they can talk about how they're feeling. We have support for grandparents. We have our online group, but we also do have one-to-one phone support. We have an online Indigenous circle of support. Our most recent 2 groups are Black, African, Canadian, and Caribbean, and support for the 2S LGBTQ plus community. So same thing, we're always trying to increase different supports. We are currently looking at introducing one for friends and family. So it's not necessarily the parents or the grandparents, but it could be, the sister of the parent or a close friend. So that's kind of our next one that's coming up, hopefully. But as I said, it's always increasing. Moving on.
There will be a quiz at the end of this presentation, and everybody is expected to remember all of those groups.
Very funny, Brandon. I struggle to remember them all some days. So we have over 30 groups in a month, just so that you know, we have them pretty well Monday to Thursday, every night of the week. We have somebody, some group running. So it's amazing that families can get additional support and they can join as many supports as they want. Moving on to printed resources. These are all accessible on our website. You can order them through the professional part of our website. Our brochures and our posters are all available at no cost, and they're also available in multiple languages. We were just able to introduce 3 new Indigenous languages, which has been awesome, and then also the other top 8 languages spoken in Ontario. And then we have booklets which talk more in depth about when families experience this. So it is written for families to read. Families can order them on our website at no cost, or healthcare providers can order them kind of in bulk from our website. There is a small fee just to cover the cost of printing with those ones, but those are available. And then families also can order some additional resources if you want to jump to the next page, Brandon. So we have ones that are for milk production, like to reduce when your milk comes in, support for families, friends, employers, grandparents. So there's a lot of other resources on our website where families can either read them online, or they're able to order them and we can send them to them, whatever they prefer. They can do that. The next thing I want to briefly touch on is the stillbirth package. So families, unfortunately, when families deliver a baby that is not born, they get no recognition from anywhere, from the government, anything official. So a year and a half ago, on October 15th, we were able to introduce the stillbirth commemorative package. We worked with PAIL Network volunteers. PAIL Network were very involved with the Ontario government. And actually, I believe they come from Thunder Bay, or they're processed in Thunder Bay. I know that much. Anyway, so this is a certificate that comes that identifies, it has their baby's name on it. I ordered one as soon as I can when I knew that these were available, because I don't have anything official that has Angel's name on it. So this is something that, you have an official document. It has the baby's name on it. You can get your birth records. The only caveat is it has to be after 20, the pregnancy has to be after 20 weeks or 500 grams. These postcards are available to order on our website at no cost too. Since this was created, PAIL Network also feels that we want to include everybody. So we have also created our own resource. It's an in-memory certificate that we mail out to families at no cost, and anybody can get that. So if it's before 20 weeks or under 500 grams, families can still access these ones. And we wanted to make sure everybody had something that had their baby's name on it, because that can be so important for many families. Another resource that we just actually created last year, we were speaking with a volunteer who is a first responder, and he said he would love to be able to give out some information about us, but he doesn't have space in his vehicle to carry our booklets, to carry our pamphlets. So we created this. It was originally a first responders card. It's a business card. You can see the front and back there. It also comes with a one-page information sheet about PAIL Network, just so that whoever is giving them out, if they just need a reminder or want to read it to make sure they know what they're talking about before they give it out. So started as a first responders, but we are having lots of healthcare providers actually order them too, because sometimes in their office. The other thing is we've had clinics that provide elective abortions. It's nicer for families to be able to slip it into their pocket, so they're not walking out with a big booklet that says what they've had done. It just gives them a bit more privacy of the procedure that they may have just had done, but those are also available on our website.
Awesome. Loralee never mentions this, but I always like to that this the first responder business card. Loralee took that initiative on herself when she got that feedback from the family panelists, and spent a lot of time and effort creating those. And it's a great resource that not only is available for first responders, as she mentioned, but other health and service professionals are finding it valuable too. So you kind of hear throughout the presentation that we love feedback. We don't consider ourselves the experts in the field. We do value the feedback of both professionals and families in creating additional resources for families or professionals. And so we're constantly taking that feedback and really trying to improve the supports that we're available, that we're able to offer families. As you can see on the slide here, we are able to offer education for professionals like yourselves. We host 20 compassionate care workshops throughout the province every year, about 2 a month. Two of those workshops are ER focused in a new collaboration with Ontario Health, where ER nurses can attend for a paid day of training. Many of those workshops are also held virtually, but a lot of our hosts are electing to bring these workshops back in person and on site at their organizations, and they're a great day, both virtually and in person, to connect, to learn, and to network. And so we meet fully for 8 hours a day. We touch on a range of topics surrounding pregnancy and infant loss, um, self-care for professionals, attachment, communication, and then we also have a family panel. We're joined for an hour by a group of PAIL Network volunteers that come and share about their lived experience of loss, and make themselves available to questions from the professionals that are attending. At the end of the workshops, we always have a survey, and overwhelmingly, the most impactful part of the day is the volunteer family panel portion. And so it really connects the content that we're sharing with the actual lived experience of families. And it really makes for a great day of learning. And so we're always grateful for our family panelists that volunteer for those. And as a former family panelist myself, and from many that we support, really impactful part of their healing journey as well. We have a great user-friendly section of our website for professionals. We have tons of resources, videos, reading materials, education for yourselves. I'll touch a little bit on our communication module in a couple slides. That's on there as well. As I mentioned, we're all constantly updating our website with resources for professionals and families, and so we really encourage everybody to check that out frequently. We have our e-learning communication module. I have another job outside of the work I do with the PAIL Network, and we have to do yearly learning modules, refreshers every year. And those suck. I hate those. They're so boring. This is not that. This is fresh and updated, some great interactive experiences, and a lot of great tips on how to communicate with families surrounding their pregnancy and infant loss. And so takes about an hour to complete. You do get a certificate at the end of it. And I really encourage you to check it out. I wouldn't just suggest that if I didn't think it was valuable or worth your time. I really think it's of value for professionals. Really straightforward, really brief, only an hour, and some really great resources. So we really suggest you check that out. We also have available an early pregnancy loss provider toolkit on our website. This toolkit came to fruition from two ER nurses in Ottawa, Laura and Jen. They found a lapse or a gap in supports available for families in their emergency department. So they started out by taking over a storage cart and just had resources, urine hats, tampons, information from PAIL, tons of resources that families experiencing an early pregnancy complication or loss in their ED, excuse me, would need. And so they really went to work at this. Through that work, they created this early pregnancy loss provider toolkit, which is a great staff resource, a patient resource, a coordinated checklist, and their supportive workplace changes listed in the document. But it's not just for use in the ED. It can be easily applicable to hospices, to community health organizations, obstetrics units, labor and delivery units, NICU units, really across the healthcare spectrum. It just gives you some really great, easy implementable changes that you can make that have a big impact on families. And so you can also locate this on our website. And through this toolkit, Laura and Chen have now become educators with the PAIL Network, and speak passionately about this throughout the province. It's a really great resource that tons of professionals have found useful. We also have available supports for Indigenous families. We have an online Indigenous Circle of Support, as Loralee mentioned a little bit ago. We have a tablet program where we're able to provide tablets for Indigenous families or First Nation communities where they may have trouble accessing technology. We can also send those tablets with SIM cards so families can access cell service so that they can access our circles of support. Loralee will maybe touch on the workshop and family events that she hosts. But on the education side, We're able to host lunch and learn workshops, targeted compassionate care workshops in First Nation communities or on First Nation reservations, in collaboration with First Nation elders, healthcare healers, and other community members in those First Nation communities. And so, really a collaborative approach. Loralee and I are also working really hard to get some education and also family events kind of sort of linked up together in First Nation communities for professionals that support First Nation families and for First Nation families. And so we're really trying to provide more supportive care and also learn from our First Nation professionals and families on how we can be a better resource to them.
Yeah, I'll just add a bit in there, Brandon. We are trying, constantly trying to learn more and provide meaningful support. And we know with Indigenous families, sometimes there can be multiple layers of grief through the years. Um, I feel very fortunate because I've been invited to several First Nations community come in. We've been able to host an event. We have a meal together. We created a commemorative event. I learn from them. I open my space up. We open the space up. We listen to them, provide them a space for some healing. And it's been really rewarding in the sense that we are learning more. We are able to provide them with more meaningful activities because they're sharing what would be meaningful for them. I actually was approached by Tyendinaga Mohawk Territory to host a retreat this fall. So in September, I'm going to be traveling there. It's only 20 minutes for me, so it's not a big travel, but we will be hosting a 1-day retreat with them. So it's slow and steady, but listening and hearing and being able to also travel into the community. Brandon and I hopefully are going to a couple First Nations this fall to host more activities and provide some education up there, up in Northern Ontario, Fort Francis and Sault Ste. Marie, I think we're going to. So it's definitely one of those things where as long as you're willing to listen and go and hear, they've been so great to welcome us, and we hope to continue to build those relationships. Moving on to awareness and advocacy, which is a huge part because so many families, when they've experienced a pregnancy or infant loss, they feel so alone, they feel so isolated. And often that awareness and advocacy falls to the families that have gone through it in the past or currently going through it. And it's so hard when you know you're in the thick of it and you can barely get through it, but you know that somebody needs to talk about this because nobody's talking about it. So we try at PAIL Network to try to continue to increase awareness and host these activities where families can come together. They can see other families who have walked in similar shoes, but also the greater community to make awareness. We are out there. We are saying, we're here. We need to support these families. So currently we have 2 events that we host each year. The first event we host is the Walk to Remember. It's always the first Sunday in June. Here's some pictures from different walks across Ontario. We have approximately 25 each year. It's always growing. So 25 locations where we have volunteers come together with families. They do usually anywhere from a 2 to 5K walk. They come back and have a light snack. We have all of our resources there. We usually have some sidewalk chalk and different things that like bubble blowing and the ribbons that you can see there, just so the whole family is included, so the children can join, so grandparents, so friends can join, and families don't feel it quite as alone on these days. So that's the first Sunday in June. And the second activity is the Wave of Light, which is on October 15th. So this is the Wave of Light is actually a global activity. So between 7 and 8 p.m. local time, you light a candle for babies that have been lost. And then as your candle goes out at 8 p.m. in the next time zone, somebody would light a candle there and it travels all the way around the world. Same activity, same idea. We have probably about 25 locations that get together. We also host a virtual one. So anybody that either doesn't feel ready to join a group or unable to join a group, or maybe there isn't a group in their location, can join us so that they still have that community. We usually have it so that the chat feature so families can post a message to each other. So that's the 2 main activities we do each year.
Awesome. Thank you, Loralee. I just wanted to touch really briefly around the idea of grief and attachment. It says grief and attachment are so woven into a family's whole experience of the end of their pregnancy or the death of their child. And so without understanding how grief and attachment really play into to that process, I don't think we can fully understand the experience of the family. And so I think it's important to understand that grief is not related to the length of the pregnancy, but to the depth of the attachment. And those who were attached to the pregnancy will experience grief. Attachment begins when the family envisions a life with a child in it, or the idea of becoming a parent. This might be especially challenging in cultural communities where motherhood or fatherhood or the number of children one has is held in high regard. How someone experiences attachment and loss is individual and different for everyone as well. Attachment is dependent on many factors, including their spiritual beliefs, or their family structure, what kind of supports they have, or situations surrounding the conception of the pregnancy, or how much time and energy and financial resources went into the point of experiencing a pregnancy or an infant loss. It's also good to note that how people may grieve their losses differently throughout their life as well. Someone who had multiple miscarriages around the same gestation can experience those losses individually in very different ways. One they could feel relief about the loss or detach from it, and the other they could have a strong attachment to or grieve deeply for. And sometimes partners attach differently than the birthing parent. For example, uh, one may grieve the loss of a pregnancy while the other is grieving the loss of a baby. Um, and so really understanding attachment and how it factors into grief is really important how in terms of how we're able to provide supports for families. Um, as you see on the screen listed here, we just wanted to share a few communication pieces with you. And often the phrases listed on the left are said to families or are heard by families that are experiencing a pregnancy or an infant loss, and they are said or meant with good intentions. But often the intended message isn't the received message, and sometimes these phrases listed on the left can hurt families or cause harm to families. And so we just like to share this slide with everyone just to show some of the phrases that their families often hear. And what we're trying to say with something like everything happens for a reason is that I want you to find meaning in this loss. But often the received message from the family is I'm being punished. Often families that hear at least the intended message behind that may be, I think there may be something good in this, or I want you to feel better. But that at least feels minimizing to the family. You're minimizing their loss. That you should have known better. You should have done something better. You shouldn't be upset about this loss. And so, I think the phrase that we hear the most that upsets family is at least, and trying to minimize the loss. Or the perception of trying to minimize the loss can really have an impact on families. We don't have a ton of time to touch on all of these, but as we mentioned, you'll get a copy of this. But we really encourage you to read through these more and try and um, put yourself in the perspective of the family that receiving some of those messages, and how that received message may come across as hurtful. Some things that you can say to families that families have shared with us that they've found helpful or compassionate or caring. You can acknowledge the loss. You can say something like, "I'm sorry." I know it seems kind of silly that one's listed, but often um, families don't hear "I'm sorry." They don't have acknowledgement from a professional, their family or their friends when they share about their loss. And so just that simple "I'm sorry" can really have an impact for families. If you're in a triage nurse in an emergency department and a family comes and says, uh, I'm pregnant, I'm having bleeding, and I'm scared, I have experience of loss, I've lost two pregnancies before, just stopping and saying, I'm sorry we're meeting under these circumstances, or I'm so sorry to hear that. Would you like to talk about it more? It can really have a powerful impact on a family. I'm saying something like, tell me about your baby. Anytime a family has an opportunity to say their baby's name or to speak about their baby really is impactful for them. So asking more questions about them, explaining to them it's okay to feel sad or it's okay to feel devastated, that acknowledgement or that validation of their loss can really be impactful. Um, I will answer all of your questions or find someone who can, but then also following up with that information, anticipating needs, being honest and open with the family, not lying or not giving misleading or hopeful information when you know that may not be true, but really being honest and open and direct so that the family can process information they're receiving and understand the circumstances, can be really, really important for them. And so, although uncomfortable, however comfortable those conversations may be, they're really important that we have those open and direct lines of communication with families. And then just we wanted to share some final thoughts about what families who experience pregnancy or infant loss would want you to know as a professional supporting other families moving forward. And they want you to know that even if I have living children or if I have another baby in the future, this baby is irreplaceable. We know that most families become pregnant. 80% of families that experience a pregnancy or an infant loss become pregnant again within 1 to 2 years, and that is not to replace the child that died or the child that they lost, but to create the family that they had planned for or had envisioned for. And so, even though families do get pregnant again, or if they have living children, that doesn't mean that the baby that they lost or the pregnancy that ended is irreplaceable. Using my baby's name acknowledges to me that you know they were here and that they mattered. Parenting my baby means making decisions, ensuring they are treated with respect and care, and knowing where they are at all times. You may think you're doing the family a favor by taking the burden or the onus off of them by doing things, but families that experience a pregnancy or an infant loss get so few opportunities to make parenting decisions for their children. Taking those away by thinking that you may be improving the situation for them may actually be taking parenting opportunities away for them. My non-birthing partner may have a very different set of memories and may need to have attention paid to them too. Absolutely. Grief isn't universal. It's very individualized and dependent on many factors. And so how somebody processes grief or a loss is very different and on a wide scale and wide spectrum. And so a birthing parent may be more upset or grieving a loss more, or a non-birthing parent may be more upset or grieving loss more, and that's totally okay too. The experience of pregnancy and infant loss is chaotic, disorienting, and traumatic. I need to understand what this is so I can start to make sense of what I'm feeling. We often hear from families that they're after a loss that they're in a fog of grief and they're unable to process information they receive or to retain information, and so being able to really thoroughly and plainly explain information to families is important. And support can be really hard to find and really hard to look for. We still, with many years of PAIL Network being the leader in this space in Ontario, we still hear often from families how difficult it was or how many years after their loss did it take them to find information about PAIL Network. And so, even though we are a provincially funded organization and there's tons of organizations doing great work in this space, information for families to find support can still be a challenge to find and to access.
So, if you do have a family who is looking for support, we have two ways currently where families are able to access this. First way is a self-referral. So, if they, having a loss and they Google pregnancy or infant loss, we will come up. Families can fill out the request for support themselves, and then we contact them. The other way is any healthcare provider in Ontario can refer their clients with their permission. So, if you go to the professional website to the refer family, as soon as you click consent you fill in your information. As soon as you click consent from the family, the whole thing opens up so you can put the family's information in there. When we do that, get that request for support, the referral coordinator reaches out within 1 to 2 business days and has a conversation with them about the different supports we offer. And families can join right away. So if she talked to them today and there is a group tonight they want to join, they will get that information and they can join right away. We have no wait list. And they can, as I said, they can access as many supports as they want at any time.
Okay, thanks, Loralee. And finally, we just wanted to share a great resource and great video that PAIL Network put together a couple of years ago, titled "Helpful Over Hurtful." And there's some really great suggestions from families of both compassionate and unfortunately uncompassionate things that were said or done to or for the families, and some really great suggestions on how to provide skilled and compassionate care to families. So we'll watch that. We'll come back and then we'll have some time for questions.
Brandon, we can't hear it.
Sorry.
Oh, you're good.
I had a loss at 33 weeks and 4 days. We had a baby girl named Grace.
3 miscarriages, 1 stillbirth.
2 pregnancy losses, fairly close together.
I've had a lot of losses, so I stopped counting at 12.
I went to the hospital because I had some bleeding, and when I got to the hospital, I was told she no longer had a heartbeat.
I happened to catch that she wasn't moving, and so we were at least blessed with having her delivered and here for 8 days with us before she passed.
You feel like you're a healthy person and this might not happen to you, or it's just not in your mind, like it's just a happy time. So when it did happen, it was a shock.
The first time you say, oh, it's okay, it's only one, we have hope. Second time you start to question. Third time, it's a chance that you could really fall into that dark space.
Going through it as a dad, it's hard too because you know, you're trying your best to support your wife. Sometimes you're trying to say the right things. You're trying to you know, do things to help everybody through it.
There were miscarriages,
chemical
pregnancies. We probably spent like $100,000 on the fertility journey and tried everything. Her eggs, my eggs. We had a surrogate, and it just never worked out.
These women and families are physically undergoing a stressful experience, but the emotional side of things and the psychological side of things is as important in terms of accessing care.
The doctor that I saw, he spent a lot of time with us, explained everything. I think we asked him the same questions a lot of times, and you could tell that he wasn't frustrated or anything. He was very calm and with care answered every question that we had. And I think that really helped.
In my experience, what was really helpful was the hugs we received from the healthcare professionals, knowing that they were human too. They sat with us, they cried with us. They held her like she was a new baby. They held her very gently, and that meant a lot to us.
I had a nurse come into the room and hadn't seen her before. I think she was starting a shift, and she came into the room and made eye contact with me, and she put a hand on my thigh and said, "I'm sorry for your loss." And that was one of the things I remember being the most sensitive and supportive during that time.
I had my GP. She didn't actually say a lot. All she did was acknowledge my loss and my experience and validated my experience.
One of the healthcare providers, I think, remembered my daughter's name, and that was really important to me.
One of the problems is that so many times families are not supported. And in particular, when it's an early loss, people just expect you to move on and to get through it and to be okay. And that's not the way it is, because you're missing a whole person from your family.
I think there were times where some medical practitioners were coming to us, and I even was thinking maybe they don't know what happened to us. They don't know that we just lost our baby, and that's why they are treating us as if we were any other patient coming for, I don't know, flu or whatever.
When they told me she had passed away, they kind of just said, "Some babies' hearts stop beating," and walked away. At the hospitals, they have bracelets, like when there's a new baby born, the parents get bracelets, and they didn't have, they only had like mom or mother and father bracelets. I don't really fit into either of those categories, so they didn't have a bracelet for me.
Basically, my baby was described as product. After having a DNC, she had said, "Oh, we got quite a lot of product." And to me, that was hurtful. My baby wasn't product to me. And, you know, I know it wasn't her intention, but sometimes terms in the medical community can be quite hurtful when you're dealing with somebody that's dealing with loss.
Pregnancy and infant loss impacts tens of thousands of families in Ontario each year. Skilled and compassionate care matters to families when they are experiencing a pregnancy loss, stillbirth, or infant death. You can make a positive difference with the care you provide.
No family expects to go through this. Nobody thinks that their baby is going to die. So I think just support. We're not prepared for it, so we don't know what to ask. We don't know what to do.
You know, maybe someone to, you know, take the time and put their hand on your shoulder and say, this is what's happening, and you know, what can we do to help?
Be sensitive, because sometimes you just say one word and it's turned everything upside down. And I know that, put yourself in the other person's shoes too. That's really, because sometimes when you do that, you find that you are more conscious of the situation. When a person is grieving, don't just do your job. Go above and beyond. Have that light within your heart that you can shine towards somebody at that time of their darkness and despair.
Just making that step to just understand that, yes, this is another patient in that night, and there are other things going on, but to this family, this is the biggest thing to them.
It's the hope and the dream of our future that we've been planning since we were a child that's now gone. And we will always remember every single second of those days that we're going through those, and we're going to remember every single person that we encountered in those days. And so you matter. You absolutely matter in building those memories of something that we're going to remember for the rest of our lives.
Sorry about that, everybody. Having computer issues here. That's a great video, and some really great suggestions from those families on skilled and compassionate care. Making a positive difference with the care that you provide. The interactions that you have with families have long-term implications on their well-being, both positive and negative. Especially in early losses, you may be an important source of support, or you may be one of a few witnesses to their experience, to their baby's life. You are a part of their story forever, and that can be such a blessing. By just shifting or just altering the great care that you're providing now with some of those suggestions that those families provided, you can absolutely have a positive impact on the families that you're supporting. It's a great quote on the screen there, that bereaved parents never forget the understanding, respect, and genuine warmth they receive from caregivers, which can become as lasting and important as any other memories of their lost pregnancy or their baby's life. Really true, really true. And so, as we mentioned, we were really quick through the content and the information we shared. We have a couple minutes left for questions, so we'll take them now. But if anybody wants to follow up after the presentation or after our session today, please feel free to reach out to Loralee and I. So yeah, we'll open up the floor to questions if anybody has any. Maybe what we can do, Haley, if that's okay, is maybe we'll do the book draw now. Loralee and I will still stick around for a few minutes. And then if anybody has any questions, feel free to put them in the chat, reach out to Loralee and I, or hang around, and we'd be happy to answer them for you.
Thank you so much. That was a great presentation, and I definitely need to become more familiar with PAIL. That was a ton of resources, so thank you for sharing the slides afterwards. I definitely couldn't keep up trying to take notes on everything. So I will pull up our spinny wheel and we'll see who gets the book today. Here we go. Ooh, Valerie. Congrats, Valerie. And I do have your contact info, so I'll be in touch with you and we can get the book to you. If anyone has thought of any questions or comments they want to make while we still have some time. Just trying to see the chat here too. There was a question, does your organization provide any grief support for siblings who also experience the loss? And what is your advice?
So, it depends on what you mean by sibling. Well, I know what a sibling is, if you're talking about children or adults. So we do have peer support volunteers who's an adult and he had lost his sibling. So we only support adults. We don't support children. We do have our Parenting Through Loss group, which is for adults to come to talk about supporting children, and we have our Supporting Children Through Grief, but we don't have any like phone support or peer support for any like children. It's all adults. I know Brandon and I both have living children, and my advice is to be as honest as you can, is what I personally have found is best. They will grow and learn as they get older and understand more, helping them understand. I should start with some family. It depends on how much you're sharing with the other children. Some families choose not to share with living children. We're very open about our daughter. So they know they have a sister. They've learned to identify those feelings. My son, when he's having hard days, he's learned that he needs to write, and he does that. My daughter is like me, and she needs to talk, so she'll talk to me. So I think helping them figure out what those feelings are, figuring out what's best for them, how to process it. It's the same as an adult, right? But they're unfortunately just learning it at a younger age because if they have a sibling that passes away.
Thanks, Loralee. I just want to just piggyback quickly. We also have a support for sibling booklet available to order on our website. Families can order that as well as professionals. There's a small cost for professionals to order that. And then we have a living child, a 3-year-old. So our daughter, Olivia, was born a couple of years after our daughter Hannah's death. And we incorporate Hannah very much into our life and talk about her with Olivia at an age appropriate level. But that's really worked for our family, and being open and honest about that, and sharing her openly and freely with our daughter seems to work for us. But as Loralee mentioned, very individualized for families. So in terms of parenting Olivia too, that's a challenge, and navigating a challenge to navigate constantly as we're always questioning whether we're not hard enough or too hard, or worried about her safety, as we've experienced the death of a child already. So challenging process to work through, and something that I don't think you can solve overnight, but kind of an evolution as you move on.
I'm seeing one comment in the chat, just saying that amazing services and programs. I wish there was something so incredible in Alberta. Are you aware of any organization equivalents in Alberta at all?
So there is PILSC, which is a nonprofit organization that does do pregnancy and infant loss. I believe they're Alberta, regardless. I'm pretty sure they're Alberta. It's not a government funded one. It's like a nonprofit one. And PAIL Network, we are trying to work towards becoming national. We are provincial right now, but we would love to be national. So hopefully PAIL Network will be in Alberta soon, but step by step. But yeah, we definitely get requests for support outside the province. So part of my role is family navigation. So I do look at different resources. So if, you want to reach out to me to say, I'm in this province, what resources have you found? I'm happy to share that with you. But yeah, it is hard because unfortunately we are the only province in Canada that has ministry funded supports.
Thank you for sharing. Are there any other questions from the group at all for our presenters? that you're comfortable asking, as a group, I should say. If you are more comfortable asking a question, their contact information is in the chat. Otherwise, we've just got many, many thank yous, many great presentations. Thank you for sharing the resources in the chat. Lots of appreciation for what you've shared today. So I thank both of you so much for your time. I will share that we do have another webinar series, our last of the 6 for this educational series, coming up at the end of the month. It'll be Thursday, March 26th at 12 o'clock, and we'll look at spiritual and an Indigenous lens as well towards grief. I'll give it one last moment for anyone to share any questions, and then I'm just going to share my screen if anyone is interested in contact information.
Yeah, awesome. Thank you again, Haley. Thank you, Stephanie, and thank you to everybody for joining us. Please feel free to reach out if you have any questions in the future. If you're looking for supports or resources, Loralee and I love connecting with professionals and families and supporting them. So please feel free to reach out with any needs that you have.